It's important as managers to know what is to be done to cope with stress in crisis situations like COVID-19. And that becomes extremely important when there is a huge literature on how people have dealt with COVID-19. And we are summarizing some of the major points in these slides. First of all, many of healthcare workers sought help from psychosocial intervention teams, including the psychosocial response team, with managers and press officers in the hospitals, psychological intervention technical support team with senior psychological intervention experts, psychological intervention medical team with psychiatrists, and psychological assistant hotline teams, which are mainly volunteers with psychological assistance training in dealing with a crisis like COVID-19. And this intervention has worked well with good response from healthcare workers, and now it's being expanded to more hospitals and people. Another thing observed during this period is that it is unhealthy to keep thoughts and emotions to yourself. So reaching out to your loved ones can improve your mental health even when you are in quarantine or working in hospitals, not allowed to reach to your loved ones. There are enough technical tools to reach out to the psychological teams or your loved ones. And the communication is the key. So the communication with loved ones and friends through phone, mails, and emails then definitely help in coping with this stress during COVID-19. So many people have used technology to reach out to family and friends, and it helped them ease to have to stay away from the family. Sometimes walking outside or watching your favorite movie to maintain a positive mentality, which may be difficult in crisis, but it is necessary. You have to find time to do exercise and watching movie and so on. Another thing, because of the social media and the media in general, there are a lot of rumors being spread. And in such cases, the manager should make sure that there should be real information, factual information provided to employees. And employees and healthcare workers do not have to be panicked from rumors and rely solely on the facts. Team leaders and managers in healthcare should rely on communication with healthcare workers to slowly resolve the stress level and anxiety. The managers should make sure that, healthcare managers should make sure that there is a facility for psychological consultation each week for employees. Regular consultation helps workers to better cope with stress. Again, we are stressing the importance of communication because many people try to hide or doesn't want to communicate their problems in this, especially in the COVID situation, because of many reasons. They don't want to be recognized as COVID exposed and so on, because of the stigma existing in the society, which is actually should not be the case. They should communicate more during these uncertain times, expressing their emotions and feelings that can lead to less stress and anxiety and solve the problems. Managing shifts, again, can be stressful, especially in the COVID times. As the disease is spreading, and many healthcare workers are in fact affected, helping each other can benefit mental health status and rely on multiple people when healthcare workers are stressed and overwork can also help. Many people are not getting enough sleep due to anxiety, but it should be the otherwise. We should have enough sleep, maintain physical activity, stay busy, eat healthy, maintain positive thoughts, avoid drugs and alcohol. This all will ultimately lead to the taking care of your body, which will ultimately help healthcare workers to be able to help others and even family members. Sometimes it's good to reiterate good life events to healthcare workers to boost the confidence to efficiently handle the COVID-19 pandemic. So those periods where there was no pandemic, those events, their achievements can be reiterated and boost their confidence, to boost their confidence. Activities like singing and painting that they enjoy while taking a break from their work can help. Utilize online therapy. Again, online therapy means psychological therapy provided through online methods where there is no direct one-to-one contact, but there is helpline provided through online, can help prevent and deal with mental illness. Taking break from the social media and news outlets, taking time to relax and contacting friends and family can definitely help, as communication is found to be the key to reduce the stress and to cope with the stress. And also, there is a stigma associated with COVID-19 still existing in the society, and we should avoid to minimize it to boost the efforts of physicians and other healthcare workers. Psychological support should be made available in different methods with the freedom to choose an approach that works best for healthcare workers with individualized emotional support plans. Rather than having a generalized approach, we should provide psychological support individualized so that it works better. Platforms like telemedicine, video chats, online forums can be used to make psychologists and psychiatrists available in the quarantine situations. Support groups, creating support groups, providing reading materials to deal with the psychological stress, all helps to cope with the stress. Healthcare workers' past can be checked to see if they have a history of combating stress or if they have any mental health issues in the past, can also help to streamline the treatment or support accordingly. Better relationship with hospitals, as healthcare workers need all kindness and trust they deserve by the community, is important, rather than spreading stigma and fear regarding COVID-19. And authorities should stop any false information from reaching healthcare workers. Authorities need to pay more attention to depression and anxiety, which can ultimately lead to PTSD among healthcare workers. Stress reduction for healthcare workers can be provided through rest areas, where they can be provided with basic needs such as food and periodic visit by a mental health counselor. Healthcare workers may combat mental health problems by monitoring their stress reactions and keeping track of exposure to pandemic-related news, especially when there is a lot of rumors spreading around. Limiting the exposure to negative news and rumors can definitely help to cope with stress and mental illness. The support through virtual clinics, chat lines, remote psychological therapies, and psychoeducation have found as better methods of stress reduction and improved mental health outcomes. Practices such meditation and yoga can definitely relieve stress, some stress at least, and so does limiting to your exposure to negative social media, according to Nee et al. And Sketo. Healthcare workers often face the burden of wearing overprotective gear to combat with the pandemic. Always wear multiple masks and always wearing multiple masks, face shields, all sort of gears to protect them actually create a lot of sense of fear, anxiety, and such cases they have to relax a lot. So we need to estimate the vulnerability among healthcare workers, provide them with sufficient information, and develop a sense of trust that seems necessary. So the manager's role in developing that trust is huge. The managers should check in with the team, allow a flexible work schedule, and make the work environment more relaxing during this stressful period so that the healthcare workers be able to cope with the stress and deliver a high quality treatment to COVID patients. Thank you.